A revolutionary step in Alzheimer's detection is here. A simple blood test measuring pTau217 is already transforming how we identify Alzheimer's pathology, and a new brain-derived version is pushing accuracy even higher. Alzheimer's disease is characterized by the buildup of amyloid beta plaques and tau tangles in the brain, which disrupt neuron function and lead to cognitive decline. These changes begin silently, often 15 to 20 years before symptoms appear. Traditionally, confirming this pathology required invasive lumbar punctures for cerebrospinal fluid analysis or expensive brain PET/CT scans. Now, blood-based biomarkers are changing the game. pTau217, or phosphorylated tau at 309-217, is one of the most promising blood biomarkers for Alzheimer's. It rises in the blood in response to brain changes involving amyloid and tau. Standard plasma pTau217 tests already show outstanding performance with area under the curve, AUC values typically ranging from 0.92 to 0.97. When compared to amyloid and tau PET imaging, meta-analyses report sensitivity and specificity, around 88% for detecting Alzheimer's pathology, often outperforming other pTau variants like pTau181. In real-world clinical studies, adding pTau217 to standard evaluations can increase diagnostic accuracy from about 75% to over 94%. It can even help predict symptom onset within roughly 3 to 4 years in some models. Recent research takes this further with a brain-derived pTau217 assay, specifically designed to target tau fragments originating from the central nervous system. In a head-to-head comparison published in 2026, scientists evaluated BD pTau217 against total pTau217, using assays like NULISA qPCR for brain-derived and Simoa ALZ-Path for total. The two markers correlate strongly, but BD pTau217 demonstrates numerically superior performance. It shows higher AUC values for classifying amyloid beta pathology, reaching 0.96 to 0.98 in some analyses, compared to 0.94 to 0.97 for total pTau217. It also correlates more strongly with amyloid PET centiloid values and excels at identifying tau-positive individuals, among those with amyloid positivity, with an AUC of 0.89 versus 0.78 for the total version. This improvement aids more precise disease staging. One major benefit of the brain-derived version is that it is less affected by non-brain factors. Total pTau217 can sometimes be influenced by peripheral sources or conditions like kidney dysfunction, as shown by stronger correlations with creatinine and urea levels. In contrast, BD pTau217 shows much weaker associations, with these markers making results cleaner and more reflective of actual brain pathology. This is especially important for older patients or those with comorbidities. These advances matter profoundly. Blood tests are far less invasive, more affordable, and scalable than traditional methods. They offer high negative predictive value, potentially ruling out Alzheimer's pathology efficiently and reducing the need for advanced imaging by up to 80% in tiered testing protocols. As new disease-modifying therapies targeting amyloid and tau become available, early and accurate detection becomes critical for timely intervention, better trial enrollment, and improved patient outcomes. pTau217 changes can appear years before symptoms, opening the door to preclinical detection and prevention strategies. Finger prick versions and dried blood spot technology are also emerging for even greater accessibility. While highly promising, these tests are not perfect. Performance can vary slightly by assay platform, population, and disease stage. Intermediate gray zone results may still require confirmatory testing with CSF or PET. pTau217 is highly specific for Alzheimer's type pathology, but should always be interpreted in the full clinical context. They support diagnosis but do not replace comprehensive neurological evaluation. The development of brain-derived pTau217 represents meaningful progress toward reliable, non-invasive Alzheimer's detection. Ongoing research and validation across diverse populations continue to strengthen its role in clinical practice and research. For anyone concerned about cognitive health, consult a neurologist to understand how these emerging tools may apply. Subscribe Project Health MD.